Hi, my name is Heidi, and I am here with two amazing professionals who took care of my smile. And I just want to share a little bit about my story and let them explain what they did behind the scenes for me. So I had spaces in my teeth for years, and it didn't bother me when I was a patient at Stafford Smiles. Dion, the hygienist, asked if that bothered me and if I wanted to change it. And I said, no, I don't. I'm fine. And in the back of her mind, she knew that I would change it at some point. But she didn't. But she let me come to that realization. When I turned 40, I wanted to make some changes in my life. And part of that was starting orthodontia to move the spaces together. I went through a clear correct process of bringing my teeth together, aligning them, and it was great, except it didn't have the look that I wanted. And I was kind of stumped because I'd gone through this process and yet it wasn't the smile that I had envisioned. And so I had smile pictures, and Dr. Stafford walked by one day and I said, I don't know what's missing. He's like, well, those teeth are too small, and moved on. I'm like, what? Could you not have told me this years earlier? But it was a testament to me that he recognizes what things can be changed to make a smile look more natural. And so after he said that, I decided it was time to make some changes and get the smile that I'd thought of. So,
what do you think of the final result?
well, I love it. I don't even remember myself necessarily without with the space, and I have a lot of confidence with it. I don't even worry about it anymore. And it's not that I didn't before. It just feels like me.
Does it seem natural, and do your friends and family think it looks natural, or do they think it looks fakey, like you had something done?
Well, nobody says it looks fake. Maybe they're thinking it, but I don't think they are. I think that I get compliments on my teeth frequently, and I didn't before. So, I think a lot of times people don't necessarily say, hey, that looks great, because they're not sure what's different about a person when their teeth are redone. I think it just looks like me. But I know that you had to do some specific things on my case, and you were in communication with Mark from Kennedy Dental Arts about how to make it look natural.
What you said, I think, is really important, because the goal is that it would just look like you. You said they just look like my teeth, only better.
Right.
That's the whole goal, how to end up. And in your case, because of the spacing, if you just do orthodontic treatment and move close the spaces, then sometimes the teeth are too small. It doesn't look right. If you just do veneers, sometimes they look too wide because there's such a big space and you're trying to fill it with just veneers, then the veneers look too wide. So yours was unique in that it was a combination. So move the teeth a little bit and then put the veneers on so that the proportions end up being perfect and it looks natural. So, and I think you did, with hers, we decided to do, I know you were very concerned about having anything done to your teeth that would make permanent changes.
Right.
And so we said, okay, let's do a very, very conservative preparation. These veneers are going to be really thin, and most of what's there is your natural tooth. So it's not like we put them into a pencil sharpener and cut all the tooth down and then put a cap on it. It's just a very thin shell, and that's something Mark is a specialist in. That's a feldspathic veneer.
Yes.
Yeah. And how's that different than?
Well, the difference is you are layering from scratch. You're not pressing a core, and you don't really have a core material underneath. You're layering it.
So you just start painting layers of ceramic on.
Yes, you can put in really nice mamelons. And,
What is a mamelon?
well, they're characterizations in the incisal third of a tooth normally.
Oh, so the
Not-
bottom
not-
part where it kind of looks jaggedy?
And then there's little translucent, like enamel rods, interproximally. Well, not interproximally. But
Right, because the front tooth isn't just flat. It actually
Yes.
has some anatomy, some contours, and
Right.
things that make it look natural.
So being able to build in some of the characterizations just initially, and not having to do that on top of a core,
Sure.
you're able to duplicate or make the veneer have really nice characterizations, and it's a very thin amount of material, so it's a more minimal prep.
Sure.
I know
Very
when you told
translucent,
me,
yeah.
I'm like, oh, I have something that's unique in my mouth. Like nobody else has my teeth. And somebody with an extreme amount of skill specifically designed things for my teeth. And I don't necessarily think about that every time I brush my teeth or see myself smiling, but it does help me in the back of my mind knowing that there's thought to what is on my teeth.
The nice thing about them is that they just blend in so well.
Right.
I mean, that because of the translucency of the material, it just, it basically just kind of disappears.
Uh-huh.
Well, and this is an interesting aside here, that when we talk to patients about doing something cosmetic with the teeth, I've had quite a few people who say, I don't want any veneers, I don't want any of those things on my teeth, because I can always tell when somebody has veneers. You know, they look chunky, they look too white, I don't want that. And so, and my response is, well, the reason that you feel that way is because you only see the bad ones. The ones that are not done very well, yeah, they are pretty noticeable. But if you look at Heidi's teeth, you wouldn't say, oh, Heidi, what nice veneers you have.
Right.
You would just say, what beautiful teeth you have.
Right.
I mean, nobody even knows she's had veneers, so they can't tell the difference between good ones and bad ones, because the good ones just look like natural teeth.
Yeah.
Like in the ones you make, people don't say, oh, nice veneers. They say
Yeah.
beautiful teeth.
Uh-huh.
Yeah.
So,
I also like that there's a reflection point that you look at so that the light reflects off of my
Yes.
veneers like a natural tooth.
Right. And part of that is from surface texture.
right.
If you just had the porcelain smooth, it would look glassy, and when the light hits it, it doesn't look natural. But if you put in a little surface texture, some people have more, some people have less, and by looking at the models of their natural teeth, you're able to determine how much of that you want to apply.
That
So-
sounds like magic. You're a magician.
He's an artist.
Right,
He's an
absolutely.
artiste.
Yep. Yeah. Well, thank you, because I love my teeth,
Well,
and I
thank
think
you.
about them. I think about them in a positive way, and I don't think about other things every day as a result of having them.
Super.